Well, good evening, everyone, and thank you for sticking around for our federal panel on the federal government's role in Medicare, avoiding Medicare fraud and Medicare assistance programs. My name is Doug Nguyen. I'm the Regional Communications Director for the Social Security Administration here in the Chicago region. And I want to just do a quick shout out to thank the National Ship and all the ships across the country, every state, for partnering with us to reach our vulnerable populations in the past 16 months, even before that even. You all serve as a valuable lifeline to the Social Security and Medicare benefit programs, and we couldn't do what we do without your invaluable help. And so with that in mind, I will now begin our presentation with the PowerPoint as it comes up on the screen. Again, I'm Doug Nguyen from the Social Security Administration, and I would just encourage everyone on the line today, on the call, to subscribe for our current updates. Our policy programmatic updates are all posted at ssa.gov/coronavirus. You can go there and get the latest updates from us. Probably one of the most popular questions that we get is how to reach Social Security, how to get help from Social Security in these times. And I'm glad to say that we have been and we remain open for business. We currently provide multiple service delivery options for all folks. Most of our services are available online at ssa.gov. You could certainly call us as well at 800-772-1213. All of our offices are providing right now we're providing limited in-person appointments for critical situations depending on the local office conditions. And so we encourage everyone to go to ssa.gov/locator to locate their nearest Social Security office in case they need to come into the office or call the office for any reason. You can see the footnote there. Most of our benefit applications are actually online: retirement, spouse, disability, or Medicare. It's only the survivors, adult and children survivor claims that need to be done by phone or in the office. So we encourage you to reach out to us because we are here to help. Again, that's ssa.gov/locator and to locate your nearest Social Security office by zip code. Again, this is an example of another valuable resource that you can subscribe to. In addition to our COVID updates, we have our newsletter at ssa.gov/news/newsletter. You can get valuable updates on this one. As you can see here, we're telling folks that since last year, we've seen lower volumes of disability insurance and SSI supplemental security income applications come in. So we need the thousands, the hundreds and thousands of folks on this webinar today to help us help others to apply for the disability insurance and SSI programs. If you need training on those programs, if you need training on how to take the SSI applications, we've got staff who are willing and available to train you to help us help the ones that you are most often in contact with that we don't have access to. So we appreciate your help in that instance. We have a special page that's designated for the Supplemental Security Income Program. It's ssa.gov/benefits/SSI. You can go here to find out more about the program and how to apply. And you can actually apply for SSI online as well. We have created, about a year ago, we've created a new website, new webpage that's tailored for those who provide caregivers, for seniors, for persons with disabilities who may need a little help to navigate the benefits puzzle. You can go to ssa.gov/third-party to find out how to help others, your family members, your friends. If you're a part of a community organization, and certainly you can go here to get publications and pamphlets as well. And I would be remiss. We've got staff right now available at the Social Security exhibit. If you go there after, after my comments or after this panel is done with, we'll have staff there to answer all of your technical questions, especially on A and B enrollment. They certainly will help you do that. Speaking of Medicare enrollment, seems like, most folks know about the initial enrollment period, 3 months before their 65th birthday and 3 months after their 65th birthday, or the general Medicare enrollment period, January through March. But, it bears repeating. The special enrollment period, we're seeing more and more folks working past after age 65, right? They continue to work in active employment. They or their spouse, both of them are covered by a group health plan. And something happens, they stop the current employment, which then stops the group health plan. We try to remind everyone, you've got that 8-month special enrollment period window to sign up for Part A and or Part B with no penalty. And that penalty is, 10% for every 12 months that you pass up filing for Medicare that you should have, because you stopped active employment and you're no longer covered by your own or your spouse's group health plan. You really need to reach out to us to go ahead and file for Medicare to avoid that late penalty, that late enrollment penalty. And we've really created flexibilities during COVID to receive the Medicare applications. The easiest way is for you to file online at ssa.gov/benefits/Medicare. If you already have Part A, you want to add Part B, you could certainly go online, complete that application, or you can fax or mail the completed CMS 40B and CMS L564. Again, we want to make sure that we get evidence of the group health plan or the large group health plan, and you can do that through the L564. You can fax or mail in those forms along with secondary evidence to the local Social Security office. And again, you can go find your nearest office at ssa.gov/locator. We also always promote the extra help for those who are interested in getting prescription drug coverage. Certainly Medicare Part D extra help helps folks to pay off their premiums, their deductibles, their co-pays, often helping folks save $4,000 to $5,000 and more. So to apply for that extra help subsidy, certainly we encourage you to encourage others to go online at ssa.gov. It's a simple 15-minute application online. Certainly folks can call us at 800-772-1213, or they can go to their state or county Department on Aging office as well. There are limits to qualifying for that extra help subsidy, as all of you on this webinar knows, but these are the income and resource limits for 2021. These may go up in the new year when the cost of living adjustments are announced. We don't know until those are announced, but those are the income and resource limits for this year. So one other topic that we always seem to never talk enough about is the scam awareness campaign that we have been going on for a couple of years now. The Federal Trade Commission tells us that Social Security fraud certainly tops the list. It seems like every year. The scam artists, they go through great lengths to trick people, especially seniors, out of their personal information or money. And our Office of Inspector General continue to receive reports from across the country about these fraudulent phone calls from people who are claiming to be from SSA. And so we go through great lengths to remind folks about the automated recordings that impersonate our employees, that sometimes you've got live agents who are impersonating us. They threaten folks saying that your Social Security number, your Social Security record has been suspended for suspicion of illegal activity. You've got to call the number provided or your assets will be frozen. If you call the number and provide your personal information, the scammer can then use it to commit identity theft or other fraud. So just understand the threats out there, exercise caution with how you handle your personal information. Certainly, we don't call folks and we don't threaten them. We don't request for advance fees for services in the form of wire transfers or gift cards. I mean, just build a habit of identifying the identity of anyone who asks for your personal information over the phone. And so just if they're saying they're from Social Security, just tell them, hey, I'll call you back through your 800 number, or I'll call my local office, and just hang up, because we will never just call you and threaten you for information. Certainly, we won't state that you're going to face potential arrest or other legal action if you fail to provide your information. So again, these calls are fraudulent. Just hang up. Don't give out any personal information. Learn how to spot the red flags out there. Certainly, many of us deal with seniors who are often isolated, and they're prime targets, in their isolation. And so help them, warn them not to avoid, warn them to avoid sharing their personal information, help them to sign up for direct deposit for their benefits, whether it's their pensions or their Social Security benefits. That way their checks will go right into their secured account and not to the bad actors. And then if you suspect fraud at all, here's some resources that you can go to. Certainly our OIG is a good resource, oig.ssa.gov. If you want to report fraud, you can certainly go to oig.ssa.gov/report, and you can report fraud that way. Otherwise, there's a National Center for Elder Abuse website that you can go to get more resources on fraud. Lastly, I want to end by talking about the My Social Security application. This is another way to protect your information and have your information stay secure. My Social Security is a convenient, secure suite of services that's designed to put you in control of your personal Social Security information. You'll need to, when you open your own account, you're going to need to unfreeze your credit report. You're going to need to unblock electronic access to your personal information, Social Security information, and then provide us, with email. Also, you need to create an account. When you create an account, we're going to ask you some pocketbook questions from your credit report. And so after that, you can choose username and password to get that one-time security code to create your account. So, and you can do it through any type of device as well. Just go to socialsecurity.gov/my-account. One of the exciting things that we're doing this year is just earlier this year, we launched an effort to educate the public about our programs and services through the redesigned Social Security statement. As you can see there, last year we provide more than 83 million statements, 19 million automatically mailed, 41,000 on request by mail, and 64 million online using the My Social Security account. And so we're constantly encouraging folks to sign up for My Social Security to get access to their Social Security statements. We have completely redesigned this statement to streamline it down to 2 pages using plain language, larger fonts, more colorful graphics, as you can see here, the use of bold print to make it easy to skim your personal information. Basically, your Social Security statement is tied to your own personal earnings record. And so this year, you can see this is an example of a person's personal earnings record in one column, and we make it easy for you to read, putting things in boxes, larger points about the benefits that oftentimes the public doesn't understand very well. So take advantage of that. The fact sheets are an exciting supplement that we're putting in this year with the statement. The fact sheets, they're age related. They're tied to a person's earning situation, whether they are fully insured, not quite fully insured, if they've got non-covered earnings or other kinds of public pensions, if they've got intermittent work history. And most important for this crowd today, we've got the Medicare fact sheet, and they look like this. Again, we're here to basically educate the public about the programs and services through Social Security and Medicare. And we explain to you in graphical format the Parts A, Part B, and Medicare Advantage Part C. We also go over your Medicare enrollment options, whether you are eligible or not. So just look for that. You can access that. We've tested it with some folks about, earlier this year. We tested it with about 20% of the population that don't currently get a Social Security benefit. So with that, I will close my presentation by reminding you to go to socialsecurity.gov/my-account to sign up for your My Social Security account. And we look forward to seeing you at the Social Security exhibit. Our staff is there to handle all of your technical programmatic questions. With that, Nick, if you can go ahead and play that public service announcement, that'll be great. I will stop.
At Social Security, we are always thinking of ways to save you time and make things easier. That's why we created My Social Security. Opening a My Social Security account gives you secure access to your personal record and interactive tools tailored for you. You can see if you are eligible to receive benefits, view spousal benefit estimates, and compare retirement benefit estimates at different ages or dates when you want to start receiving benefits. Already receiving benefits? Use your account to change your address, set up or change direct deposit, get a proof of income letter, and more. In most states, you can also request a replacement Social Security card. Save time. Go online. Open a My Social Security account at ssa.gov/myaccount. Social Security, securing today and tomorrow.
Produced at U.S. taxpayer expense.